Start.
Good evening, all. I, Dr. Shreyas S., consultant Ayurvedic obstetrician and gynecologist, welcome you all to the interactive webinar for obstetrics and gynecology enthusiasts, Eve Care. The topic being integrating medical sciences in OBG care, a future prospect, in association with Himalaya Drug Company. So as we had streamed our video, we had received lots of questions for our speakers. And we have got two eminent speakers who are stalwarts in their own field or specialities. One, Dr. P.V. Tiwari, madam. Madam, welcome, madam. Yeah, the next speaker is Dr. Lata Venkatram, madam. Madam, welcome you, madam.
Namaste. Namaste.
So a small brief introduction about our speakers. Dr. P.V. Tiwari, madam, AMBS PhD, ex-Dean of Ayurveda, IMS BHU, presently additional medical superintendent in Mata Anandamayi Hospital, Banaras. Madam has 50 years of clinical experience, guided more than 30 PG scholars and 20 PhD scholars. Madam has published more than 200 research papers and authored more than 20 books. Our next speaker, Dr. Lata Venkatram, madam. So madam is the lead consultant and senior obstetrician in Sringeri Sharada Peetham, Rangadore Memorial Hospital. Madam is the president of RCOG Trust Bengaluru chapter and also the past president of BSOG. So today we will be having an interaction with both these stalwarts. We had received few questions, most questions, and we have a few questions which we have selected would be asked. The few common questions have come. So let's start our interactive session. The first question is to Dr. Lata Venkatram, madam. So, madam. Yeah.
Sorry, I'm having some problem with the network. So pardon me for that. Yes, please.
No problem.
Yes.
Yeah. The question for today is from Dr. Ahalya S., Principal of Government Ayurveda Medical College, Bengaluru. So madam has said, respected Dr. Tiwari, madam, and dear Dr. Lata, madam, this is a good seminar. Both of you are pioneers in the field. Dr. Tiwari, madam, brought out the Ayurveda OBG to students and practitioners through her phenomenal work, and Dr. Lata has always assured in belief in and encouraged practitioners of Ayurveda. Can you share your integrative approach in treatment of infertility?
Yes. Thank you very much for that very nice question, Professor Ahalya. First of all, congratulations, Dr. Shreyas, for organizing such a wonderful webinar, which would highlight the importance of the integrated approach. It's been long desired, okay, to come to a common platform and treat women or patients together. So the long cherished dream is coming through. So to answer Professor Ahalya's question, yes, integrated approach has got much better success, in my opinion, in the treatment of infertility, though I haven't audited or published papers. I think it is worth that we bring research into the integrated platform very soon, not only the clinical, but also the treatment modalities, but also the research. Anyway, coming back to this, see, the basic things, that is ovulation, the tubal factor, the male infertility, all are helped enormously with Ayurveda when we use it as a complementary or adjuvant treatment. Ovulation induction, especially, we might have to use, especially with PCOS and things like that, we might have to use higher doses of medications, even gonadotropins and things like that. And that can have very many side effects. And also it can lead to multiple pregnancy, ovarian hyperstimulation, so many things. So with Ayurveda, combining it with Ayurveda, I feel there is more controlled ovulation. And also I have seen professors like, many of them, Professor Ramesh, Professor Ashalata, many of them treating even tubal factors or well-proven tubal factors like blockage and things like that, even Ashamans, like Professor Ashalata has shared, and improving the fertility. Male infertility, we are very, actually modern medicine is very poor at treating male infertility. So we don't have many medications, to be very honest with you. Male infertility is very well treated, be it liquefaction, be it lower sperm count, lower motility, and even the morphology, etc., etc. So I feel male infertility, my esteemed colleagues for treatment. More than that, what is called as unexplained infertility, where implantation can be a problem, and it needs a lot of endometrial receptivity, immunomodulator activity, modulation, etc. So in those cases where modern allopathy, modern medicine doesn't have much solutions, Ayurveda goes a long way. And I have seen women with recurrent pregnancy loss who have been infertile. If they've been treated with Ayurveda, I think the implantation rates and the successful pregnancy outcomes increase quite exponentially. So with all this, I would like to say, even in premature ovarian failure, I have seen a couple of patients who have conceived, I have documented. I was very, very surprised. I even spoke to the Ayurvedic physician who treated. So I'm quite sort of, what can I say, fascinated by the way our esteemed system of medicine works. I mean, in this country, Ayurveda is the esteemed system of medicine, I would say, and how it has worked and has given us very good results in infertility. It is important that every modern medical obstetrician knows where the lacuna in modern medicine is and seeks the help of our Ayurvedic colleagues.
Yes, certainly, madam. Certainly. Thank you so much for saying us as our esteemed medicine, Ayurveda being our esteemed medicine. Thank you so much. Yeah, the next question to Dr. Tiwari, madam. So, madam, Dr. Vandana Kulkarni, madam is a professor and HOD from Ghataprabha from Belgaum, Karnataka, has asked you a question. Respected Pranam to respected Dr. P.V. Tiwari, madam. Though we are following preconceptional care for a couple before pregnancy and Garbha Samskara for female during pregnancy, still we are unable to prevent congenital abnormalities in fetus. Can you advise any unique and integrated management?
Thank you for the question. But be very sure that all the abnormalities are not treated. Because what is the cause of that congenital anomaly? Whatsoever with the modern limited investigative procedure, we are able to diagnose something. But as far as the Ayurveda concerned, it also relates in the palingenesis, that is rebirth, and the effect of the deeds of the previous life and also of this life. Because if you go to the Ayurveda, what did it say? Vijatma karma shay kala doshai, matu tatha aharavi ahara doshai, Karutushan, Gudan Garman, Angabakase. So we did it. Now, we have no method in our way to clear the defects of the ovum and sperm. Because the chromosomal other defects are very well equally important for pregnancy loss. Then what Ayurveda says is the previous, the deeds of the Atma Karma. Atma Karma refers to deeds of the father, mother, and also the Atma. Atma which is coming from the next in the previous life. Atma brings with itself the sattva that is the psyche along with the vikara, dharana, and also brings a panchmahabhuta, which carry the effect of deeds of the previous life to this life. Now, it is not investigable by any parameter available today. But when nothing comes to our hand, we always suspect that it is something which is not in hands of the human being, and it is in the hands of higher up. I think you all are, when you all are using the modern investigative procedure to diagnose the cause, because still we don't know the cause of this repeated pregnancy losses. It's very difficult to treat it. So one must investigate the cause. Until we don't know the exact cause, this has to be treated on the basis of symptoms and what sort of features are seen in the patient. If at all there is some genetic abnormality, naturally nobody can prevent the abortion or the premature delivery. So if at all we know the cause, and at all, if at all the patients are not being helped with that, then the procedure should be adopted. That is in the first 1 or 2 cycles that must be chosen. Chosen of the patient, which will also give a chosen or maybe may influence even the spermatogenesis and orthogenesis and prevent some disorder. Very difficult to say, but this has to be 100% right. But if there is no good data, nobody can claim that this sugar has given some success. Then the patient should be treated prior to conception. There are certain abnormalities which may prevent certain things, and if at all the body is prepared, the female and male body is prepared before the conception, before they have the marital relations, if those things are used, probably for future life may be better and the child may get out of congenital anomalies. Because as far as the endocrinologists are concerned, I don't think that there is any treatment neither in the Ayurveda nor the modern. Because again the possibility is, if at all this social is done during the process of maturation of the ovum, or even with the male, this will be tried. But since it is a time-consuming matter, neither the patient nor the physicians are very much willing because of certain limitations. It's because the results are not to be definite. Yet in some of the cases when these things have been tried, there are good results. So only I will advise that first try to know the cause. And if the cause is something wrong with the female and male, that cause should be treated. And if not, then the Shodhan Karma should be done at least for 1 or 2 cycles. Because ovum matures only in first 14-15 days after menstruation. So this period is very important, and specific dietetic management and Shodhan given at times it does give the result.
Yes, madam. Yeah, thank you. Thank you so much, madam. So you said that Nidana Parivarjana is the first thing.
Yes,
and,
yes.
And the karma of the mother and father, they are very important.
Yes.
Thank you so much.
In the pre-pregnancy dietetic management, dietetic and mode of life.
Exactly. Thank you, madam.
That's very important.
Thanks. Yeah, the next question to Dr. Lata, madam. Question is from Dr. Vishala, madam, from Kolhapur, Maharashtra. Madam is a professor from there. Madam, how do we improve integration in managing adolescent and reproductive age group health issues, as it is addressed very well in Ayurveda?
Yeah. Adolescent health issues are ever increasing. Unfortunately, 1 in 5 adolescent girls have PCOS in many parts of our country. It's not only menstrual irregularities, but obesity and also a lot of other issues like hirsutism, acne, dyslipidemia, being more prone for diabetes early in life, more prone for hypothyroidism, etc. That is the metabolic syndrome early in life is what is the problem that is challenging the adolescent girls now. Mainly, I think it's very, very important. It's just not, well, most of the time in modern medicine, what medications we give might not sort of cure the basic pathology which has caused the disease. It might just relieve the symptoms in the form of blocking or sometimes expressing. So I feel it is very, very important to have an integrated approach, especially the lifestyle modification has to come from Ayurvedic concepts, dietetics, and also the ahara, vihara, vichara. I don't have to sort of emphasize on it at all. It is important that we have combined clinics for these girls and help them out. Obesity is such a rampant and wild problem. I think Ayurveda has got a lot of role to play in controlling the adolescent obesity. See, these girls, adolescent girls, when they become mothers, when they embark on pregnancy with all these background problems, they're going to produce progeny with similar problems. So it perpetuates through generations. So it's very important that we have proper adolescent care, optimal adolescent care, not only for treatment of problems, but for prevention also. Ayurvedic concepts have to be brought in. I think education, health education, both from modern medical people and also Ayurvedic people, having combined clinics are two of these. Two of the important things that I can say that it will bring down, hopefully bring down the adolescent problems. I think it would be easier for us to have a combined platform because the telemedicine has helped us so much. We don't have to be sitting next to each other in the clinics, but we can have a combined integrated platform very soon, and quite a few people are planning to launch it. So I think adolescent clinics should have an integrated approach and also have alternative systems of medicine on their panels. Okay, so that's how I feel we should go about it.
Yes, thank you, madam. Thank you so much. In fact, the concept of combined clinic is very much needed to probably address all such issues, I think. Yeah, the next question. Yeah, next question is to Dr. Tiwari, madam. Question is from Dr. Deepthi Gudi. Pranams, madam. My doubt is regarding Yoni Vyapat. According to Charaka classification of Yoni Vyapat, Acharana Yoni Vyapat has been mentioned under Vatala Yoni Vyapat, while Acharana Yoni Vyapat has lakshanas of Kapha Prakopa. Please clarify and do the needful.
Well, the Kapha Prakopa is being said only on the basis of one feature that is control. First thing one must know, the eating is not caused only by cough. Definitely, this is classified under Vata disorder by Charaka. Now, Charaka has further said that why there is little non-cleanliness in Adhaman. There manifest some jantus and those dreams is eating. But further, this indicates something else. The woman doesn't get satisfied with the sex. That means she has become a nymphomaniac. And when the woman has nymphomania, it's not a type of, actually the feeling is a very typical feeling that cannot be said only absolutely as eating, but the patient has a feeling to have some rubbing or something. That's why she's not satisfied with the sex, and that is nymphomania. Now, nymphomania is when not getting satisfied with the sex. Hypersexuality may be considered as a Vata disorder. So it is not only, and moreover, whenever there is cough, there must be some discharges. There must some problem or identified water discharges. Any manifestation of the cough caught within the vaginal canal or the cervix or the uterus is never free from any discharges. Maybe simple water discharges, maybe mucus discharges. So there is no mention of the discharges. Main feature of the disease is feeling of irritation in the vaginal canal and hypersexuality. No, this is not a cough. This is actually, if you take click very sincerely, it is a vata disorder. More all the urinary rogas and any disease of the body is not exclusive by any dosha. All the doshas are there, one is a predominant. So here what is said to be as a predominant. Otherwise it is said all the urinary rogas they are due to what? So what is always predominant? And here, since the feature is only irritation and excess desire of the sex, this should not be taken as a normal itching and also with the tongue is also due to what? So how can one decide that it is covered there only on the side itching? I don't accept this. This is the vata discharge because she has hypersexuality and itching is without any discharges. So it is certainly vata disorder, no problem.
Okay, yes, thank you, madam. So I guess Deepthi has got her answer there. It is from Kajol, Dr. Kajol Jaiswal. So torch infection treatment is advised by modern gynecologists. It's not advised, sorry, torch infection treatment is not advised by modern gynecologists in case of RPL, recurrent pregnancy loss. Why?
Same.
Yes, madam, Lata madam's question.
Yes.
Yeah, torch infection treatment is not routinely advised in case of RPL. Why?
Okay. See, if somebody gets a torch infection, that is Toxoplasma, rubella, or cytomegalovirus infection, actually they will develop antibodies. So in subsequent pregnancies, in fact, they are protected from these infections. So it is not known to cause recurrent pregnancy loss. So there is no need to treat. There is no need to investigate, first of all. There is no need to treat. There is no need for pre-pregnancy investigation and treating if there is some IgG level, IgG level is high or IgM becomes positive. No, not really. Because the body itself will develop immunity once there is an infection and it will fight it out. And if it has caused one pregnancy loss, say for example, one pregnancy loss, she will be immune to it and it won't cause another pregnancy loss, because she would have developed antibodies to it. Is that clear?
Yes, madam.
So there is no need to test for TARC in recurrent pregnancy loss. There is no need to treat them for it.
Yes, the same question.
It's no longer an investigation, which is in the list of investigation for recurrent pregnancy loss because of this reason.
Yes, certainly. The same question is to Dr. Tiwari, madam. That is, how do we manage recurrent pregnancy losses? Management, your clinical experience, madam.
And I'll come to this in my first answer. This first, it should be treated before the patient has conceived. Knowing the cause, because when you have to know this cause, what is the cause of that recurrent pregnancy loss? And if at all whatsoever cause that we have to treat before the patient conceives. If you are treating just after the conception, then there be possibility that your treatment may not succeed. You have to maintain the life or the reproductive system of the women healthier before she is conceiving. So this cause should be investigated and treatment should be prior to conception. At least 1 or 2 cycles prior to conception, some Garbhastra drugs etc. should be given and the Shodhan should be done, and only in a healthy state the patient is conceived with free from the cause, she will continue pregnancy forward. And during pregnancy also, whatsoever the drug prescribed, Sutta had days for every month-wise treatment. If that month-wise treatment from the start of the first month of 9th month given, some of the patients they do continue. Then other drugs which are helpful in the abortion, those are to be given, but not after pregnancy, not after pregnancy. Before she should be both partners should be treated prior to pregnancy, after the treatment. When they conceive, then the treatment should be started from the first month onward. If God blesses, the patient will have normal child. Thank you.
Yes, madam. Yeah. The next
I think I
question
would very much agree, Shreyas, I would
Yes.
very much agree with madam, because the earth has to be prepared before the seed is sown. Okay, so it is important that we realize that, that as modern medical practitioners, we should realize that Ayurvedic treatment or even allopathic treatment should be started prior to pregnancy, couple of months prior to pregnancy. And we should have combined clinics for that also.
Yes, madam. That is kshetra, preparing the kshetra, what we say in
Yes.
our Ayurveda.
Yes,
Yes,
yes.
perfectly. Yes, again, another question to Dr. Tiwari, madam. Madam, a patient who has pre-eclampsia, how can we treat her with Ayurveda?
Well, the Sushruta has given very correct line. व्याधेर नास्ति विना दोषाः यस्मात् तस्मात् विचक्षणैः अनुक्तं हि दोषाणां लिंगैर व्याधि समाचरे. Here the detail is not described in Ayurvedic classic. That means whatsoever are the features and specific treatment, that specific feature should be given. Here in the pre-eclamptic state, mainly it is the edema, hypertension, and albuminuria. These are three features. Now in this, as per symptoms, some diuretic, which is pranava, and first is the rest, dietary management. Again, I'll say dietary management and the rest. Then the drugs which are benefit for the hypertension, drugs which are benefit for punarava. Because to be very frank, I do not prescribe any anti-hypertensive drug during pregnancy. I'm very honest. Except that some Jatamasi, some Shatavari, if it is failed, I always prefer modern drug. Because for Ayurvedic, we are not sure whether it is teratogenic or not. Whether it has any, because we have been tried, the drugs are being used to the women at any age. But while using, because very few cases of the eclampsia are being treated or come to the hospital nowadays, because from the very early period, the antenatal care is taken. Now, if there is it can be prevented. Prevention treat, we have also treated cases of prevention. The best drug to be used is in any prevention. From 6 months onward, Gokshuru we have used, and also reduce Jatamasi, which is went on Veda, and also which is sedative. So with doing prevention has been active. But when there comes hypertension, usually I do not prefer very high drugs during pregnancy, since we do not know the effect of the drug on the fetus. Generally, I try to manage with simple drugs, that is dietary pranava, Gokshuru, and some major drugs with little bit of Samanta, Jatamasi, and Shatavari. These drugs are given, complete best given, and the dietary management as per dosha is given. Further, if it is not responding, I always advise my younger generation not take risk with anybody, refer the case to the modern science. Because my theories from the very beginning in my life have been, try use only that drug which you can use by yourself, which you can advise your next sentence. Not that you are trying on the public. If you cannot dare to take your own relation with the Ayurvedic drugs in the academic stage, I advise that they should, other patients should also be referred to the proper person. So in earlier stages, this can be treated prevention, because I have managed those, because it is a necessary recurrence that prevention has we have achieved. With, from third month onward, we started treatment. Third month, then 6 months onwards, we started Gokshuru. 7 months onwards, started Jatamasi. Now this is Jatamasi, and we have a good result. But once pre-eclampsia, that is in early stage treated. But when it has reached third stage, where eclampsia can occur, I don't advise any treatment from Ayurveda. Being Ayurvedic, I'm very blunt. Thank you.
Yes, yes, madam. Certainly, we must know our limitations, and this is the scope where integration could be used, I suppose. Lata madam has something to share on this, I suppose. Yes, ma'am.
Yes, I think there are what are called as big fives. Yeah, they're all placental pathologies. Preeclampsia is a placental pathology, prematurity, ruption, IUFT, and also to an extent diabetes and preeclampsia are interrelated. So using Ayurveda for prevention, that is for better placentation, goes a long way. In people who have had previous severe preeclampsia, early onset severe preeclampsia, or very severe preeclampsia, even late onset, I have put them onto my colleagues, and a combined treatment has prevented preeclampsia in many cases with good outcomes. Another big add to the big five, it is preeclampsia, abruption, intrauterine growth restriction, intrauterine fetal death, and prematurity. So these are the 5 things which I feel Ayurveda can improve by improving placentation. So it goes a long way. Once the disease is established, I don't think it can, stop it or halt it very well in my experience.
Yes, yes. Yeah, certainly, madam. The next question is for you, Lata ma'am. It is from Dr. Prem Raj Karnal. Respected Dr. Lata Venkatram ma'am, what is your take on single oocyte retrieval and single embryo transfer during IVI or ICSI on account of natural quality merits of gametes? Will quality supersede quantity when it comes to multiple oocyte retrieval, multiple ET, and artificial multiple pregnancies?
Yeah, let me say that I'm not an infertility specialist, but going with nature is always safe. And single oocyte retrieval, single embryo transfer, though the pregnancy, the success might be slightly less compared to multiple embryo transfer, etc. But the complications are less. The quality, especially with multiple pregnancy, they can have more problems, especially prematurity, which is associated with not only short-term problems for the progeny, but long-term problems also. So if we are talking about quality, single embryo transfer, single oocyte retrieval are better. Okay, people say that they want to store the oocytes, etc., etc. Again, yeah, storage has its own implications, etc. So if we are believers in nature, if we are aradhakas of the nature, I think it's important that we respect single oocyte or single embryo transfer. That's my view.
Yes, yes, madam. Yeah, the next question to Dr. Tiwari, madam. Question is from Dr. Priyanka Hazare. How Lashuna can act as a nectar for a woman?
Anything which is said to act as nectar, it is only the metabolism of the body. Lasun is in Kashya science, Lasun is said to be as a the Lasun curve is prescribed. How does it act? Because it is the job of the modern medicine. From Ayurvedic point of view, I can say that it acts. It acts at the level of digestive fat, that is Agni. That Agni is very important for improving the Agnis. All the seven the Agnis of the body. And when all the Agnis are better, metabolism is going to be far better. And once entire body metabolism is normal, even whatever diet is taken, that is proper, totally absorbed and digested and assimilated. Nothing else is going to improve. And a sign is what because it is the rasa. When the ahar rasa is found very well, when it is absorbed and utilized by Atma, even man, then it goes on well and it will act as a rasa. So it acts at delivery of Agni. That is at the digestive fire and other Dhatvarnis as well. Because the Pachaka Agni influences all these Dhatvarnis. And for metabolism, all these Dhatvarnis are important. So it acts at the level of Agni, then influences other Agnis of the body and also the rasa to going to the brain. So mental, physical health is improved.
Yes. Yeah. Probably there are a lot more questions and we have time constraint. We are almost finishing our session. Another last two to three questions. And this question is to Dr. Lata madam. Question is from Dr. Asha Sridhar, professor from Kerala, and also Dr. Neeta Maisekar madam, professor from Maharashtra. Both of them have similar question. Madam, can you highlight the recent advances in treatment of endometriosis and adenomyosis?
Yeah. Well, it is a difficult problem. Endometriosis, adenomyosis, they are difficult problems to treat because they're associated with high incidence of recurrence, and the etiology is not very clearly known. See, in modern medicine, what we do is either we dry up or destroy. So drying up is with medications like progestogens, and also which have their own side effects, etc., or GnRH, which could be, that is gonadotrophin releasing hormones, which can be used for a shorter period. Newer and newer generations of progestogens have come into the market with hopefully minimal side effects. I mean, but still it is not easy for women to use those medications, to take it on daily basis, or have injections, or have a coil, which actually, if they're desiring conception, it might be the other way around. Okay, it might act as a contraception. The next thing is destroying. So laparoscopic surgery, especially in extensive endometriosis, it can be very difficult, can be associated with morbidity, mortality, etc., and also with high recurrence rates. So there is no good answer or a definite answer for endometriosis, which is supposed to have an immunological basis. When we have combined Ayurveda with allopathy, we have found better results, because your system has a lot of immunomodulators, which is, I mean, it's not available in allopathy. Actually, it can be immunosuppressant like steroids or antimetabolites and things like that. So, or I mean, other immunoglobulins and things like that, which can be quite expensive and also has a lot of side effects. So in endometriosis, I feel we should combine it with Ayurvedic preparations to have a better result. So there is not much of advancement in the treatment of endometriosis. We are still groping in the dark because the etiology is not very clearly established.
Yes, I guess Tiwari madam can add on a few points on treatment of endometriosis and adenomyosis in this month.
I also stand on the same footage as Dr. However, what I have been trying, there are certain preparations which do some effect, but then associated with certain complications. We are using Keshur Gulu content. These are drugs which are reducing, unless the overgrown tissues. But because they're added with the Gulu, their chances are most of the patients start process bleeding. So what we are doing these drugs along with the drugs which are for treatment for like that. Both combined treatment does give some effect. The ovarian endometriosis is relatively better or reduced better. Of the best one, this is fibroid analysis. The results are very good. But in uterine or ovarian, the results are not so highly successful. If the patient is in the latest stage, or she doesn't want any pregnancy, then it is better to treat. Otherwise, it does cause some problem. But temporarily, these can be given. The treatment can be given. But not with high success rate.
Correct. Exactly, madam. And another question to you, madam. The question is from Dr. Neeta, madam. Charan Sparsh to Tiwari, ma'am. What can be done to revive in developing an effective Ayurvedic contraceptive? What can be done?
That has been done, and that is yet to be done. Because till today, to be very sure, we have not found any clear-cut or any quantum oral paper. Number of trials have been done. I have also published certain papers, but not very successful. And then because they have to be used constantly. Even all the drugs are to be used for 20 days, 21 days, and the dose becomes higher than other modern drugs. So literally the effects are not so good. The drugs are not very successful. Because even the RCH, this council, they have tried number of drugs, but foolproof drugs we don't have. Synthetic drugs are at Chinese start, but Ayurvedic drugs not available.
Yes, madam. And we have another question from Dr. Divya Pawar to Tiwari, madam again. Do we have any references or management of antepartum hemorrhage and postpartum hemorrhage in Ayurveda?
If I say no, because these both are emergency conditions, and I don't think that anybody should take any risk during emergency. Now, antepartum hemorrhage, placenta from placenta side bleeding is there, it will be mild. With simple rest and slight sedatives and the blood which are from NIV which are restricted blood, those can be given. If at all there is no recurrence and fetal fetus doing well, there is no and other Garbhasthapan drugs and the drugs for the fetus for proper growth and development, maintenance of the health can be taken. Now, as far as the second, if at all the APS due to this ability of placenta, I think it will be highly risky because that time this ability of placenta reached within the myometrium and that changes it into cavalier uterus, but hysterectomy has to be done. I don't, and if once the disability of placenta starts, it's a very mild, one can wait and watch. It's a simple treatment. If it is advancing, then I think it's going to take life of the fetus.
Yes. Okay. Okay, the next question to Dr. Lata, madam. There's a case study, madam, case history. Case is in a lady with age of 45 years with no menstrual problems. Follicular study, USG, blood readings, all are showing normal with infertility since 20 years of married life.
Sorry.
Yeah. It is a case.
Sorry, last sentence I didn't hear. All
are normal. Blood readings are showing normal. And
sorry,
she's diagnosed blood readings, blood reports.
Okay.
Are normal. A follicular study, USG, everything is normal. No menstrual problem. But infertility since 20 years of married life. Male partner is having normal seminogram. What would you suggest? And please.
Yeah. See, this is what is called as unexplained infertility. Even if you put the egg and the sperm next to each other, as it happens, as we see in IVF under the microscope, it might not fertilize. Or even if we broke the shell of the egg, and that is in ICSI, zona is broken and the sperm is put in, but still fertilization might not happen. Even if fertilization were to happen, implantation might not happen. The early cell divisions, which happen even before a lady misses her periods, might not be all right. So there are so many factors which we don't know. So there, it could be, it comes into the category of unexplained infertility. And the quality of egg is, again, questionable at 45. Though you say all the blood parameters until follicle count, etc., are normal, but still, I would say unexplained infertility, unfortunately, is one of those which is difficult to sort of treat. And I don't know whether this lady has tried IVF or ICSI or whatever. I don't know. I mean, has she tried?
No idea, madam. So
no idea. So these are the few things which we don't have an answer. So for unexplained infertility, again, combined Ayurveda and allopathy treatment really works well. And as madam beautifully put it, it is the karma and the atma who will have to, and the jiva who will have to decide the karma of the parents and also which jiva has to enter. I mean, the Lord has to decide. We don't know who decides. I mean, of course, it's the Lord who decides.
Yes, yes. Thank you, madam. And almost we have come to the end. We've got many questions. And the questions, we would be taking them with the other speakers because we have topics for Dr. Ashokan sir has sent us message. In fact, we have Ashokan sir has asked about gestational diabetes mellitus. We have a separate topic on that, sir. And many other questions are there. And there is one experience which is shared by Dr. Asha Lata madam. So Asha Lata madam was retired principal. So she says, I am certainly for integrated approach. For example, one patient with history of infertility due to uterine synechiae conceived within 3 months of intrauterine treatment to understand the positive response. We need integration into. So similarly, PCOD, amenorrhea needs one single hormonal tablet to induce cycle, and rest is well taken care of by Ayurvedic treatment. So probably that should be the need of the hour integration. As we have two stalwarts, I think you will have to now encourage us to start doing integrative approach in caring in OBG care, because that was our main motto of this webinar, is to integrate both the systems of medicine. Your view on this, Madam Tiwari, Madam? Concluding remarks on this.
Yes, sorry, I didn't hear it. What is the question?
Yes, yeah, Madam. Your view on integrative approach of Ayurveda and allopathy for OBG care. Your last concluding remarks.
Yes, I have. Because with me in BHU, I had other modern drugs. Usually, we do not use modern drugs. And even in this Mathanandi hospital, there's one Dr. Gadar who's MBBS and DTU. She's working, she wants to run Ayurveda and she's working with me. Whenever there's in, I ask her to do some treatment. So they don't, and rather this is more effective. This is more effective. Because there are few cases in which IVF failed twice, thrice. And with this bilateral tubal blockage, all the efforts and the tubes didn't open. Subsequently, she was given IVF treatment for 3 cycles, and then when next went for the IVF, and she conceived and the child developed normally. She had, after she then delivered. So there are certain things, because in Ayurveda, if you want to know exact mode of action, this can be explained only from the Ayurvedic point. If you want to know from one, it is the scientists where to do the experiment, or researchers that what level of the body that acts and how does it act. Moreover, when I feel we are using a drug as a whole, human bodies as a whole, every Ayurvedic drug, if you take or you fractionate it, it has one compound, suppose it is effective for the bleeding, other compound just must have which is contradictory, and the balance in such a way that when it goes to the body, it gives good result. So whatever we are treating in Ayurvedic drug, concept is slightly different as far as body effect. And I'm sorry, because last time I forgot PPA to tell the person where they were questioned. But PPA, again, it is known, cause is to be known. Whether it is rupture, where it is somewhere tear, what is the cause of PPA? And that cause is to be treated. If at all it's only the relaxation of the uterus, simple some hot packs, if at all, and the drug. Simple Langli can be applied or the overhead and other drugs which are which can be given, the show can be given. And then if you can be able to again say that you send to refer and then we do the or you take that from the one side, because emergency our no drug immediately cross the blood, no drug immediately contact the uterus. We take the help from one, no problem.
Yes, yes, madam. And now the concluding remarks from Lata, madam, regarding this.
I think we should recognize the lacking in every system of medicine, and we should respect each other. Each system of medicine is very respectable, and we should do research and publish papers to say to the world that whatever we are doing in an integrated way is probably producing better results. So these are the 3 R's that I would recommend. So recognize, respect, and do research. That would, and bring in an integrated platform, give option, look at the person as a whole, give option to the patient. So you need the doctors, especially the modern medical doctors, to be educated regarding what Ayurveda can do, and the vice versa also, the Ayurvedic physicians to know what modern medicine can do, and then where we can meet eye to eye. And I think I have proposed an integrated form where both the systems of medicine, or whichever system of medicine is involved, will take the history in their respective ways and then discuss among themselves, and then, I mean, shut down the computer for probably 15 minutes of consultation, 15 minutes of discussion, behind the screen, because we don't have to sort of show our, I mean, what can I say, the discussions or the disparity or the disagreement. So 15 minutes, we can discuss it between ourselves, come up with a plan of action or treatment, and counsel the patient for the last 15 minutes. So each consultation might take 45 minutes, but that is still worth an effort. So if we wanted to sort of bring a respectable, integrated platform for consultation, I think all of us have to be educated, including the patients, what is available in each system of medicine, and it should be on a virtual platform. That's what.
Yes, madam. So I guess a lot more of research is needed here. So more of research can help us grow more and prove the world that integration can help in treating many such conditions. Thank you so much, madam. Thank you so much, Tiwari, madam. And thank you so much, Lata, madam, for being a part of our webinar, first webinar of Eve Care, and an idea of integrating both systems of medicine in OBG care. Thank you so much.
Yeah.
So to our viewers, yeah. So we will
Thank
be
you very
going
much.
with the next. Yes, thanks, ma'am. Thanks a lot. So for our viewers, we would be going. We have much more topics, and the next topic would be about the abnormal vaginal discharges. So we would be posting our video by tomorrow, and you can put your questions. So we have two speakers who would talk on abnormal vaginal discharges. So both would be from one speaker would be from Ayurveda and another speaker would be from modern gynecology. From Ayurveda, we have Dr. Yan Beni, who's from Assam. So Yan Beni Humsai, madam, from Assam. She will be talking about the Shwe. And from the modern system, we have Dr. Parimala with us. So Parimala, madam, is a famous gynecologist in Bengaluru, who's also called colposcopist. So madam would be speaking tomorrow. Tomorrow will be the video and followed by the live session. So with this, for further more updates, I ask you all to subscribe the YouTube channel of Salubrity Doctor, like, share, and subscribe the YouTube channel and the Eve Care webinar, which is brought in association with Himalaya Drug Company. So now we have a message from the Himalaya Drug Company. I ask Dr. Wahid Pasha to give a message from the Himalaya Drug Company.
Good evening, viewers. Indeed, it's been a Hello, good evening, viewers. I hope I'm audible. Due apologies, my video isn't available at this point of time. On behalf of Himalaya Drug Company, I'd like to extend my heartfelt gratitude and thanks to Dr. Lata ma'am and Dr. P.V. Tiwari ma'am for sharing their valuable time and giving us a deep insight into the possible integration in the future. Integration has been a hallmark of Himalaya Drug Company, and we have been striving on this since 1930. This particular platform will further pave way for further possible betterment of this particular agenda. And I hope this will help us provide better healthcare products to the masses and better healthcare system to the masses. I'd like to also congratulate Dr. Shreyas for this initiation. Indeed, a pleasure to be a part of it. Thank you so much for having me here, and wish you all the good luck for your next coming webinars as well. Thank you so much, Lata ma'am. Thank you so much, Tiwari ma'am, once again, on behalf of the Himalaya Drug Corporate. Dr. Shreyas, all yours.